enormous rasayana properties, and let us just have a look on that. Amalaki is a rich source of vitamin C. It is rasayana, vayasthapana. The references are there. It is told as Vrishya. Amalaki is rasayana. Amalaki is balya. Amalaki is a nutritive tonic. It is hrudya. Amalaki is deepana pachana. Even though it is sheetam, it is amlam deepanam pachanam. It is vatanulomanam, sramsanam, kafagnam, मूत्रलम ज्वरग्नम गर्भस्थापनम शोणितस्थापनम प्रमेहग्नम त्रिदोषहरम. Acharya Charaka says Amalaki is Tridosahara. Ashtanga Hridaya says that Amalaki is Amlam Ushnam, Haritaki is Kashayam, Amalaki is Amlam Sheetam, Haritaki is Kashayam Ushnam. This is the only difference between Haritaki and Amalaki. Otherwise, all the benefits of Amalaki and Haritaki are same. The pharmacology of Amalaki and Haritaki are same. Deepani Pachani Medya Vayasthapani Param Ushnavirya Sara Ayushya Buddhi Indriya Balapradam Kushta Vaivarnya Vaiswarya Vishamajwaran Shiro Akshi Pandu Hrudroga Kamala Grahani Gadan Sashofa Shoka Atisara Meda Moha Vamikrimin Shwasakasa Praseka Pliha Anahas Gara Rogam Vibandam Srotasam Gulmam Urustambam Arochakam Haritaki or Amalaki. Haritaki is Kafavatagna and Amalaki is Pitta Kafagna. This is very interesting pharmacology. Haritaki is Kafavatahara, but Amalaki is Pitta Kafapaham. Amalaki is Pitta Kafa Pradana Tridoshaharam. Haritaki is Vata Kafa Pradana Tridoshaharam. So in all government dispensaries, government hospitals, Amalaki is abundantly available as a source. So Amalaki is Guru Sheetam Maduram, and it is Madhura Vipaka, Sheeta Virya, and it is a mild CNS depressant. Amalaki is used in different forms. Amalaki Churna can be used 3 to 6 grams twice a day with Madhu or Grita. Amalaki Kashayam can be used. Amalaki dried or taken for preparation of Kashaya. Amalaki Swarasam can be used. Amalaki Avaleham can be used. Amalaki Ghrutam is available. Dhatri Ghrutam, directly Amalaki Ghruta is available. So Amalaki in all forms is mild CNS depressant. When in neuropathies, when in case of trigeminal neuralgias or any neuralgias, myositis, when you want, even in seizure disorder, and Amalaki works as mild CNS depressant. Like Zeptol tablets are prescribed by modern doctors, Amalaki Ghanavati can be given in CNS depressant effects. It is anti-mutagenic. I want to highlight the anti-mutagenic effect of Amalaki. Whenever you are in OPD and IPD, please note this. Amalaki acts as anti-mutagenic. Then a doctor should understand that what is mutagenic. Mutagenic is a phenomena which causes mutation in the DNA or genes of a cell is called mutagenic. Anti-mutagenic is the drug or diet which will prevent the damage to the DNA and prevents the mutations. So mutation can happen at one place of a cell's gene or chromosome, or mutation can happen at the block level. They can do multiple mutations. And mutations can be very well treated pharmacologically with dismutagens. Dismutagens are the agents which will block the mutation. Amalaki is anti-mutagenic, Amalaki is desmutagen. These desmutagens are drugs which will cause deactivation of carcinogens. In the body, carcinogenesis takes place. Carcinogens are chemical compounds or proteins which will open the cancer process. And anti-cancer drugs are going to do deactivation of carcinogens. And desmetagenesis is one of the effect of anti-metagenic drugs. They inactivate the mutations before they interact with DNA. These desmetagens are compounds which will prevent the DNA damage before it starts. So, antioxidants are also anti-mutagenic. These anti-mutagenic drugs have dismutagen effect, anti-mutagen effect, and antioxidant effect. In three way, anti-mutagenic effect is assessed. So, Amalaki is passed as dismutagenic agent. Amalaki is passed as bio anti-mutagenic agent. Amalaki is passed as antioxidant drug. So, because of all three properties of Amalaki in research, it is said that Amalaki is anti-mutagenic. You can give Amalaki rasayana after samshodhana to any patient in where family history of carcinoma is there. Any family contains carcinogens opened and causes cancer, in that generation, next generation or next children should be treated with Amalaki rasayanam. So it will do dismutagenic effect, anti-mutagenic effect, and antioxidant effect. So this is one important aspect of today. We are talking on Amalaki. Amalaki is having anti-inflammatory, hypoglycemic effect, and anti-ulcer effect, anti-fungal effect, antibacterial effect, antimicrobial effect, anti-tumor effect, and immunomodulatory effect, adrenergic effect. It is potentially adrenergic. So there are need of adrenergic drugs. When you want adrenergic effect, then you can think about using Amalaki. Amalaki is good for adrenergic effect. It works on HIV-1 reverse transcriptase inhibition effect. Whenever HIV-1 is positive, Amalaki rasayana, Amalaki ghanavati should be given. And in case of liver and GI tract disorders and heart disorders and nerve disorders, Amalaki is the best. Liver, GI tract, heart, and nerves. In these cases, Amalaki should be prescribed. Amalaki churna or Amalaki ghanavati can be prescribed. And in case of diabetes, Amalaki churna alone is indicated when pitta kapha pradhana lakshanas are there in madhumeha. Amalaki swarasam should be prescribed. For example, patient of diabetes type 2 having दाह लक्षण नेत्र दाह करपाद दाह लक्षण आमलकी स्वरस आमलकी कल्का आमलकी घृत or आमलकी चूर्ण आमलकी घनवटी can be prescribed. In the same way, in some of the patients, when patient requires digestion and vision promotion, when you want to improve the vision, 6/6 vision is lost. When ophthalmologists say that the vision is in trouble, the patient's perception of the vision, quality of the vision is decreased due to the diabetes, diabetic ophthalmopathy or diabetic vision disorders. In that also Amalaki can be prescribed. Amalaki is antioxidant, detoxicant, anti-bloating. Whenever the stomach has got bloating effect, lot of people come and ask what medicine to be given for bloating. For bloating, Amalaki alone stands as a good drug. No need of going to the preparation Hinguvachadi or Dashamulartam Pipalyasom. Rather than going to a compound drug, you just stick on to please mute yourself. Someone is open. Please mute yourself. Insulin sensitizer. Amalaki. So whenever there is insulin resistance, even manufactured used by beta cell, but it is not properly utilized by the cell. Cell is able to accept the insulin molecule. Someone is unmuted. Mute yourself. Taking any allopathy drug for type 2 diabetes where abdominal obesity is there, patient is having dyslipidemia, patient is having acanthosis nigricans, is indicator of insulin resistance. When insulin resistance is there due to dyslipidemia, then also Amalaki alone, Amalaki Ganavati, what we can do is to reduce the dosage of the Amalaki, Amalaki Swarasa Bhavita Amalaki Churna or Amalaki Kwata Bhavita Amalaki Churna can be used. We do Amalaki Ganavati. In the Amalaki Gana, add Amalaki Kwata Bhavita Amalaki Churna. Lot of disturbance is there.
Excuse me, sir. Sir, someone is like Bishop name. Who is that, sir? Please mute, sir.
So, insulin sensitivity or insulin resistance is a huge market. Every Ayurveda internee or a PG scholar or a beginning practitioner can give just Amalaki Churna for sufficient dose with sufficient timeline, then this insulin resistance can be reduced. So no drug alone is effective. Then add Amalaki Ganavati, Amalaki Churnam, Amalaki Swartham, Amalaki juice available in the market, or Amalaki Kashayam, Amalaki Kritam. If patient is Vatapradana Kruchapramehi, Amalaki Kritam, if patient requires Amalaki Asavam, Dhatri Asavam is available, that Dhatri Asavam can be given. If patient requires some high dose, Amalaki Ganavati, Amalaki Swasabhavita, Amalaki Kwatavita, Amalaki Ganavati can be given with 20 tablets, 2 tablets 3 times a day initially. Then insulin sensitivity can be improved by Amalaki alone, which is having a rich source of vitamin C, and it can be used. And when you want to reduce the carbohydrate breakdown should be slowed down. You want to slow down the process of carbohydrate breakdown, then give Amalaki Churnam. And Amalaki works as blood thinner. What else you, whenever patients are taking blood thinners with many times acetyl salicylic acid or ecosprin is not so suitable to some of the patients who are undergoing any surgical procedures or who are having bleeding tendency, long-term
Please, Dr. Kavita Bishak, mute yourself.
Okay. And as a anti-platelet aggregating effect of Amalaki is no basmas are required.
Somebody by name Kavita, unmute yourself. Bishak ಅಂತ ಜಾಯಿನ್ ಆಗಿದ್ದೀರಿ ನೋಡಿ, ಪ್ಲೀಸ್ ಅನ್ಮ್ಯೂಟ್ ಯುವರ್ ಸೆಲ್ಫ್.
ಸರ್ ಮೀಟಿಂಗ್ ಕತ್ತಲ್ಲ, ಓನರ್ ಅಡ್ಮಿನ್ ಯಾರಿದ್ದಾರೆ ಮ್ಯೂಟ್ ಮಾಡ್ಬೋದು ನೋಡಿ ಅವರಿಗೆ.
ಎಸ್.
So, anti-platelet aggregating effect of Amalaki is a safe drug. So rather than going to any synthetic drug, in cardiac patients, in cerebrovascular stroke patient, in dyslipidemia patient, atherosclerosis patients, especially in atherosclerosis with hypertension, diabetes, dyslipidemia or hridroga with stroke chances, in all of them, modern doctors are prescribing ecosprin 50 mg as a low dose antiplatelet aggregating drug. In the same way, one Amalaki Churna or Amalaki Candy or Amalaki Avaleha or Amalaki Ghritam, Amalaki Ganavati, as the case may be. If patient is Krusha, Vata, Pradana, Rukshatvam is there, give Amalaki Ghritam or Amalaki Churna mixed with Ghritam. Or if patient is Kapha Pradana, then give Amalaki Ganavati, Amalaki Kashayam, Amalaki Asam. And in case of Amalaki, one important thing we should remember is Amalaki should be given as a rasayana vayastapana drug. So rasayana vayastapana drugs make, actually Vidanga and Amalaki are two best vayastapana drugs. All aging phenomena, aging process, if there is early aging, akala jara, akala vali, akala palita, patient is having the jara lakshanas, akala jara lakshanas, Amalaki is a good choice. In high blood pressure, Amalaki can be given along with Jatamamsi Churnam, Amalaki Jatamamsi Churnam. In Ashmari, Amalaki can be given with any of the fruit juices like sugarcane juice, black grape juice, you can pineapple juice, you can use any fresh fruit juice as anupana for Ashmari patient. When patient is having cerebral atrophy, Amalaki Ganavati or Amalaki Grita can be given with Kushmanda Avaleham. Whenever there is cerebral atrophy, regularly I see that in many of the patients with old age or many of the patients with stroke, age-related cerebral atrophy is a diagnosis of radiologist. What is that age-related cerebral atrophy? They don't have anti-atrophy drugs yet. Till now, modern pharmacology don't have anti-cerebral atrophy drugs. So they tell this cerebral atrophy is insignificant. This is age-related. Age-related means due to the old age it has happened, you can neglect it. But when they get one day anti-cerebral atrophy drug, they start cerebral atrophy can be treated by drug. So better start Amalaki Gritam for patients of cerebral atrophy, whether it is Alzheimer's disease, dementia disorders, post-stroke cerebral atrophy disorders. In all of them, Amalaki Gritanasyam, Amalaki Kalka Taladharanam, Amalaki Kwata Shiro Dharam, Amalaki Taila Shiro Dharam, all these can be practiced. We also note that many of the patients with GI tract ulcers from stomatitis, pharyngitis, esophagitis, gastritis, gastroduodenitis, ileitis, colitis, and lastly the anal canal ulcers. In all GI tract ulcers, from mouth to the anal canal, Amalaki Gritam, Amalaki Avaleham, or Amalaki Ganavati can be prescribed. Amalaki alone has got Pitta Kafaja Vrana Haram. Pitta Kafaja Vrana Hara. So whenever there is inflammation with ulcer, Amalaki stand-alone drug can be given. But it should be given for sufficient period of time. Amalaki has got anti-cirrhotic effect. Anti-cirrhosis effect is there with Amalaki. Amalaki can be prescribed with Punarnava Mandora, Aragyavardhini, and some rich protein diet, Drakshadi Kashayam, Drakshamalakadi, Avaleham can be prescribed. Amalaki is good prescription in Amla Pitta. So Bunimbadi Kashaya, Avipattikara Churna with Amalaki Ganavati. In case of Agnimandya, Dashamula Arshta with Amalaki Ganavati. In case of Admana Atopa, Karaskara Vati, Kapikachu Ganavati with Amalaki Ganavati can be given. In case of Daurbalya, fatigue, weakness, we can give chronic fatigue syndrome, Balarishtam, Ashwagandharishtam, Amalaki Gritam. In chronic gastritis, Patoladi Gritam, Amalaki Churnam. In case of peptic ulcer, with Amalaki Gritam. In case of Parinama Shula, Kamaduga Rasa with Amalaki Gritam. In case of Anatra Shula, epistaxis, Nasagata Rakta Pitta, Ushirasava and Amalaki Avaleham. In case of hematemesis, Urdagata Rakta Pitta, Amalaki Churnam, Sarivadhyasavam. And in case of chronic bacillary dysentery, as an substitute or as an antioxidant, Amalaki Ganavati can be given with Kutajat Tvagadi Leham. In case of Pandurugam, Punarnava Mandura, Dhatri Loha, Mandura Vatakam can be prescribed with Amalaki Gritam. In case of Jirna Kamala, chronic hyperbilirubinemia, Falatrikadi Kashayam, Kamaduga Rasam with Dhatri Kashayam, Dhatri Avaleham can be given. In case of alcoholic liver disease, chronic alcoholic liver disease, Aragyavardhini, Sharapunkaksharam and Amalaki Ghritam. And in case of cirrhosis, Punarnava Mandura, Aragyavardhini and Vardhamana Amalaki Prayogam. Actually, in cirrhosis patients, the fixed dose may not be effective. Then what we do is Amalaki Ganavati Vardhamana Prayogam. Amalaki Ganavati, 500 mg BD dose or 500 mg TAD dose may not be sufficient to suppress the cirrhosis process. Then what is expected is Amalaki Ganavati Vardhamana Prayogam, 1 BD, 2 tablets BD, 3 tablets BD, 4 tablets BD, 5 tablets BD, and coming back to 1 BD. Like this, Vardhamana Amalaki Ganavati Prayoga in cirrhosis of liver with ascites and liver pathological changes. Amalaki can be used in Akala Vali Palita. When patients are having Akala Vali and Akala Palita, then also Amalaki Churna with Madhugruta Prayogam. Amalaki Churna with Vishama Pramana Madhugruta Prayogam is effective in Akala Palita, Akala Vali, where many people come with cosmetic problem like hyperpigmentation over the face. I'm not talking about Venga. There are hyperpigmentation over the forehead and Ganda Pradesham. In these cases, Amalaki can be used as a washing agent. Amalaki Kashaya should be used for washing the face. Amalaki Churna should be used as a scrub. Then Amalaki Lepam. Just Amalaki Churna mixed with rose water applied over the face. It is a Shita Lepam, improves the Tvak Varnam. Amalaki is Varnakaram. In that way, Amalaki can be used. Amalaki is having all the benefits of Vayasthapana, Rasayana, Medhya, Vrishya, Vajikara. It is having very good effect in asthenozoospermia. Amalaki Ganavati, what we did is, myself and Dr. Harish Soni, one of the PG colleague of me, what we did is 7 times Amalaki Kvata Bhavita Amalaki Ganavati we prepared and it was given for asthenozoospermia. And 2 tablets twice a day after Virechana it was given. It was given for 48 days, 1 mandala prayogam. And then we found that rapid linear progressive motility of the spermatozoa are improved. The nidation failure disorders in male infertility and female infertility, when DNA of the spermatozoa is not good, DNA fragmentation index if it is more than 26% or 29% as the case may be, in such cases Amalaki Churna, Amalaki Ganavati, Amalaki Avaleha, Amalaki Gruta Prayoga, Amalaki Gruta Uttarabasti, if you give that, the nidation will be improved, pregnancy fertilization rate will be improved. And in case of post chemo and post radiotherapy, patient will have stomatitis, anemia, and patient will have glossitis, and patient is unable to eat, swallow food. Then Amalaki Gruta Prayogam, you give instantly 50 ml of Amalaki Gruta at the end of every radiotherapy. After the end of radiotherapy, patient should be given Shamananga Rasayana Snehapana. 50 ml of Amalaki Gruta should be given at the end of every radiotherapy. And if you see that